Millions of adults suffer from some form of acid reflux or heartburn every day. And the reason why this is important is that untreated acid reflux can lead to one of the fastest growing cancers in the country, esophageal cancer. It often taking medications to stop the symptoms every day. But a recent study co-authored by a UT Health Austin surgeon shows that one device is helping nearly 90% of patients get some relief now. Joining me to talk about this is Dr. Trip Buckley. Good morning, Dr. Buckley.
Good morning. How are you?
I'm well. Let's start from the beginning here because, people have heartburn and acid reflux all the time and they think, oh, it's nothing. I just had spaghetti last night or whatever. You say not so.
Well, we have about 60 million Americans in the United States suffering from GERD, which is gastroesophageal reflux disease. And that is folks that are having heartburn maybe twice a day and it really affecting their quality of life. And so the mainstay treatment for that is medication, something like Nexium or Prilosec,
Right.
things like that. But we know that about 30 to 40% of those patients are going to have symptoms beyond that medication. And so there are other treatments for it. And yes, we looked at a study involving a surgical procedure, an outpatient surgical procedure, to see if we could help those patients.
I see. So out of the GERD patients, then now you're looking at a smaller portion. But what about them when they take the medication? Does it not go away? Does it get worse? What happens?
Well, fundamentally, GERD or acid reflux and heartburn is caused by a sphincter malformation at the lower esophageal junction where the esophagus meets the stomach.
Okay.
And you have acid coming up into the esophagus, and no amount of medication is going to stop the active reflux. So we can tamp down the symptoms of heartburn by taking away acid, but we're not stopping the actual disease process.
Okay. Plus, you got to kind of like pop all that medication
All
all
the
the time.
And there's some problems with that too.
Yeah. Okay. So now you were part of a study. Tell me about the study.
Indeed. So we looked at patients that were having symptoms on medication, and often they'll go to twice daily medication, so really having to take those medications a lot. And we said, okay, well, of the patients that are needing to go to twice daily medication versus a surgical procedure, what's going to do better? We found that the surgical procedure, again, outpatient surgery, stopped the symptoms and reduced all the acid in 90% of those patients versus only 10% in the medication arm.
Okay, really quickly. So this device does what? How did it help?
Well, this is an artificial sphincter.
Acid
So
suppression
again,
therapy.
at the junction of the esophagus and the stomach, this goes around the esophagus and it opens and closes. So it's like a true replacement for that sphincter, and you can see here in the
I see.
animation
Yeah, it just closes that off.
It does.
Yeah.
So that sphincter's not working very well, and so when you eat, food can come through that and it opens and closes, but in the closed position it prevents reflux into the esophagus.
Got it. And so 90% of your patients are like, yeah, I'm getting relief.
They're fundamentally much better.
And that also closes down their risk of ever getting esophageal cancer.
Well, we'd like to prove that more in the future, but certainly we can hopefully arrest the whole process of progression of disease to Barrett's esophagus and esophageal cancer.
And really quickly, for folks who feel like this is for me, what should they do?
They should call us at UT Health Austin, the Center for Heartburn and Esophageal Disorders. That's 324-GERD or 4373. So 512-324-4373. We'll take care of them.
Dr. Trip Buckley, thank you.
Thank you so
Very
much.
important work.
Yeah.